So in the Arise Hub, we work with partners, co-researchers, participants, many of whom live and work in informal settlements. And some of these questions have come straight to us from Slum and Shack Dwellers International.
Yes.
And we're working in collaboration in Kenya, Sierra Leone, Bangladesh and India. So people are asking, what measures should we take in our households and communities to prevent the spread of disease? We do not necessarily have ready access to soap or water. Social distancing is also going to be challenging as our communities have a high population density. So in these contexts, what would you advise in terms of prevention?
Yeah. So the first advice I give is general, generic advice, and that's quite straightforward. It's to do the simple things that you do if you have a cough or cold. So these might include, for example, just regularly washing your hands where that's possible, or avoid touching surfaces, avoid contact in terms of shaking hands with other people. In fact, my colleagues in Nepal are very happy that the Namaste greeting has become more popular. And avoid touching perhaps surfaces that might be communal surfaces, for example, door handles or other surfaces that many people might have touched. That's common sense. Other things are, if you do have tissues available for your coughs and colds, then do use them. If you have a bin available, try and bin them. And we call that catch it, bin it, kill it in the UK. But obviously if you don't have those available, which many people won't, it's a good idea if you can just to try and cough or sneeze into the crook of your arm, and if possible wash it afterwards, but that really avoids the spread of droplets to other people. So I think those are the general advice for individuals. In terms of household advice, obviously the same kind of rules apply really. Just try and keep surfaces as clean as possible. We know that alcohol-based cleaners, sodium hypochlorite or hydrogen peroxide-based cleaners do work in killing the virus. The other things that you could do are potentially try and increase the ventilation within your household, especially if someone's unwell. If you have doors or windows, try and keep them open. We do know actually in informal settlements, actually ventilation of households is often quite good. I do appreciate that sometimes it may be cold or sometimes there may be security issues, but where possible, try and do that. And if you can open your window, your curtains or let sunlight in. The evidence isn't great from the real world, but we do know that UV rays and heat in some cases can destroy viruses, so I think that's worthwhile to do. And I think the other important thing is that if you have somebody in your household who is unwell, who has symptoms, if it's at all possible, if they could try and either use a different part of the household or potentially sleep or eat in a different part of the household. I think it's vital that we let people know that we are not stigmatising them for this. We are supportive of them, but what we're trying to do is just keep each other safe. If you can't isolate someone within the household, perhaps do things a bit differently. If you eat from the same bowl, perhaps think about not eating from the same bowl. And as I said, if somebody is able to maybe not use the same cutlery, if you use cutlery, maybe not to use those or the same cups just during this period of illness. In terms of social distancing, these really, social distancing sounds quite a grand term and it actually sounds quite scary, but really it's whilst we have this pandemic of coronavirus, of COVID-19, to try and keep distance, so to avoid contact with people, as we said, from the household who are having symptoms of COVID-19, but that also goes for the community as well. There are big movements towards working from home where possible. Now, clearly for some people that's going to be extremely difficult, and some people do not have access to, for example, virtual or internet to do that. But if you are formally employed, then it's a good idea to talk with your employer about that. The advice is to avoid large and even small gatherings. So in the UK, for example, that's pubs where people gather to meet, cinemas, theatres and restaurants. We know that if you're a working age adult, actually most of your contact is in the workplace, but whereas if you're an older adult, say you're towards 60s, it might actually be in the home, at the shops and other things. So I suppose it's to encourage you to think about where your main points of contact might be, and adapt some of the advice that's been given. If, for example, a point of contact is your place of worship where people congregate, it might be a good idea to consider whether or not you should stay away from that place temporarily or consider other forms of worship. There are, for example, shebeens, obviously, or drinking houses in certain places that would also be advisable to stay away from. The other thing that you could do is, if you use public transport, is to think if there are other ways that you could get to work. For example, walking or bike. Appreciate that may be difficult in some places, or whether you could vary your hours, so go at times when they're not extremely busy. Appreciate this advice isn't always possible to follow, but I think it's good to at least consider. The final thing is that even with your friends and family, this is hard, and we're all going to find this hard, but we need to try and avoid large gatherings with friends and family if we can, because you have the same risks within those gatherings of transmitting illness. So where possible, try and keep in touch through other methods. We're all trying to support each other through this, and these measures won't be easy, but I think we're trying to do this for the sake of ourselves and our families, our communities, and the global community as well.
Thank you very much. So how do you treat COVID-19 at home? Are there any low-cost measures we can take?
Yeah, so how do you treat COVID-19 at home? I think the first thing to say is that the simple measures are, again, the best. The majority of people will have virtually no symptoms or very mild symptoms: fever, cough, shortness of breath. Things you can do are the same things if you're ill with anything else, so keep up your fluids, have a balanced diet where you can, rest well, take rest where you can. I think thinking and planning ahead if you're unwell, and asking people who can support you to perhaps get you food, for example, and bring food in for you, to obviously inform employers and things, is useful. If you smoke or drink, it'd be advisable to try to stop doing those, because they don't help your immune system. In terms of if you have fevers, the usual rules apply really. If you have availability of paracetamol, it's a good idea to try and take it within what's prescribed on what's recommended on the box. But if you don't have paracetamol, simple things like cold compresses, towels with cold water are useful to try and bring your temperature down. And again, opening those windows and trying to let some air through. There aren't any direct treatments available for COVID-19, and to be honest with you, they're not actually necessary in the vast majority of cases anyway, like an antivirus, an antiviral medication. In a small group of people, they may develop bacterial pneumonia and may require antibiotics, but that is a tiny group of people. Antibiotics don't work on their own really for COVID-19, so it's not advisable to go and get antibiotics from the pharmacy unless you seek some advice about that. The vast majority of people, as I said, will not need antibiotics, and will get through this with just some rest at home.